How common is schizophrenia? Have you ever wondered how often schizophrenia affects people around the world? This mental health condition is more common than many might think. Schizophrenia impacts about 0.3% to 0.32% of the global population. This percentage translates to roughly 24 million individuals worldwide. To put it simply, that means about 1 in every 300 people has schizophrenia. Among young adults, the numbers are slightly higher. The prevalence in this age group is around 0.45%, which means about 1 in 222 young adults may experience this condition. Schizophrenia typically begins in late adolescence to early adulthood, with men often showing symptoms earlier than women. From an anthropological viewpoint, schizophrenia is a mental disorder that appears consistently across various cultures and regions. While the prevalence rates are generally similar worldwide, some countries report slightly higher rates. For instance, China and the Netherlands have shown increased occurrences. In contrast, lower rates have been noted in certain areas of sub-Saharan Africa and the Middle East. These variations may be influenced by genetic, environmental, social, and cultural factors that affect how schizophrenia is expressed and diagnosed. The onset of schizophrenia usually peaks in young adulthood, particularly between the ages of 18 and 24. As people age, the prevalence of the disorder tends to decline. Interestingly, there are no significant differences in prevalence between males and females globally. Schizophrenia can have a profound impact on individuals and their communities. It often leads to significant challenges in personal and social functioning, requiring ongoing support for many. From a biological anthropology perspective, researchers study the genetic components of schizophrenia and how they interact with environmental factors. This research helps to understand the origins of the disorder and its variations among human populations. In terms of public health, schizophrenia creates a considerable burden due to its chronic nature and the disability it can cause. About half of those diagnosed with schizophrenia can improve enough to live and work independently. However, many individuals requiring long-term support. The disorder is also associated with a higher risk of early mortality, often due to related physical health conditions. Understanding schizophrenia through the lens of anthropology allows us to see how human genetics, environment, culture, and social structures influence its prevalence and experience. This perspective helps us view schizophrenia not only as a biological condition, but also as a phenomenon shaped by human diversity and societal factors.